We will begin by explaining the way the body normally functions. The spinal cord is located in the back of the body and is surrounded by a bony cage called the vertebral column. The spinal cord is a long, thin, tubular structure made of nervous tissue that extends from the brain to the lower end of the back. The primary function of the spine is to send signals from the brain to various parts of the body and send them back from these parts of the body to the brain. The heart and two kinds of blood vessels are responsible for sending and receiving blood from all parts of the body. The blood that goes from the heart supplies every part of the body with oxygen. Oxygen is necessary for life. This blood is carried by the vessels shown in red color. These vessels are called arteries. After the oxygen from the blood has been used by different parts of the body, this blood is sent back to the heart by the vessels shown in blue color. These vessels are called veins. All the parts of the spine are supplied by arteries and drained by veins. The arteries that supply the outer covering of the spinal cord are called dural arteries. The veins that drain the spinal cord are called the spinal veins. It is important to know that normally the red arteries and the blue veins should not connect to each other. Now we will explain the problem the patient is facing. Sometimes, due to unknown reasons, a connection forms between the red arteries and the blue veins of the outer covering of the spinal cord. This is not normal. Doctors call this problem spinal dural arteriovenous fistula or spinal DAVF. The blood flow from these arteries is greater than normal and is under high pressure. As a result, it cannot flow through the veins like in a normal situation. This causes an increase in the pressure in the system of blood vessels, which results in changes in the spinal cord and causes problems for the patient. In this situation, the patient may experience the following symptoms: increasing weakness in one or both legs, problems in sensation, problems in passing urine or motion. There are two kinds of tests that can be done to check for this condition. An MRI scan is required to see if there are any signs indicating the presence of a spinal DAVF. However, an angiogram test of the spine is important to evaluate the condition and identify the exact artery causing the spinal DAVF. For the angiogram test, a needle is usually inserted into the artery of the right leg. Through this, a catheter tube is passed into the arteries of the body to identify which artery is feeding the spinal DAVF. A liquid substance called contrast is then injected through the catheter tube into the arteries of the spine. This angiogram test makes it possible to see the blood vessels in the spine. Images are then taken on the screen inside the DSA room. These images show details of the condition. Now we will explain the treatment options available. The spinal DAVF must be treated by either embolization or surgery. In our department, we do embolization. This treatment happens inside the blood vessels. For this, we do not open the spine of the patient. Embolization puts medication or synthetic material through a catheter tube into a blood vessel to stop blood flow to an abnormal area. This treatment is done the same way as the angiogram test. We will put another catheter tube through the arteries till the spine. Once the catheter tube reaches the spinal DAVF, we will put a medicine to close it. The procedure is done once and closes the spinal DAVF completely. The procedure will prevent further problems for the patient. However, the problems that have already been caused may not recover. At times, with continued and regular physiotherapy, they may completely recover, but this varies from patient to patient. There are certain risks involved in this treatment. A small clot can form in the leg where the artery is punctured. There can be injury to any artery when the catheter tubes are being inserted. At times, the medicine or material used during the procedure may pass into the wrong artery and cause new problems to the patient's body. We hope that this presentation has helped you understand the patient's condition and the treatment for it.